Hi, I'm Dr. Ryan Stratford, a urogynecologist at the Women's Center. I'm going to speak a little bit about constipation. Now, that's not something that anyone likes to have, and it's something that can cause a significant amount of abdominal discomfort, bloating, pain, and spending a lot of time in the restroom. So there's ways of treating this that are very effective that are not going to cause long-term problems with dependency on medication. The first thing to know, and it's true for all patients, is the fact that diet, which includes high fiber, fluid intake, and exercise or movement, affect the bowel of everybody. So if you increase your activity, you increase your fluid intake, and you increase your fiber intake, you will definitely have an improvement in your bowel movements and having softer stools. Constipation by definition means having hard stools. That can mean also being obstipated or having infrequent stools. But the key is if the stool comes out very hard, like pellets, then that's a problem. Whether that's happening twice a day or only once a week, it's a problem. Treating that requires using something to help move that bowel movement through the colon. The colon's primary purpose is to reclaim water. So the longer it stays in the colon, the more dry it becomes. It stretches the colon. That stretching causes abdominal discomfort, and it can lead to future diverticular development, which are these little pockets that develop stretching out the wall of the colon. So it's good to keep your stools running smoothly and soft. One of the ways of doing that safely and using medicine is using magnesium. Magnesium can be purchased in either a pill form or a liquid form like milk of magnesia, or a very concentrated form called magnesium citrate, all of which will very well help the bowels to move more freely. That increases the fluid through the bowel so that it doesn't get reabsorbed, and that allows the stool to stay soft. There are also stool softeners. Docusate sodium, also called Colace, can be used on a regular basis, and that's also purchased over the counter. You could also use temporarily stimulants like Senna or other laxatives. However, I would not recommend using those on a regular basis. If you try these over-the-counter methods and try to increase your fluid and fiber intake, and you still are having problems, I highly recommend that you reach out to your physician, either a gastroenterologist or a urogynecologist like myself. It's important to treat constipation. One, it'll help reduce some of your pain and discomfort, but two, it'll prevent future problems, including straining, which can lead to vaginal prolapse or breaking down of support of the vaginal wall, as well as hemorrhoids. If you have further questions, I recommend that you go to our website at thewomenscenter.com.